is recognized as Men's Health Awareness Month, a time to encourage men to take better care of their overall health. While cancer remains a major concern, health officials say the focus is also on prevention, regular checkups, and healthy living. For years, the conversation around cancer awareness has largely centered on women. But when it comes to men's health, the conversation has often been much quieter. Many men are less likely to visit a doctor or seek medical attention when something doesn't feel right, and those delays can sometimes have life-changing consequences. That was a message at today's Men's Health Forum, which brought together healthcare professionals, advocates, and members of the public to encourage men to take charge of their health through regular screenings, healthier lifestyles, and routine medical checkups. Throughout the forum, medical experts stressed that early detection remains one of the most effective tools in the fight against cancer and reminded participants that good health begins with prevention and paying attention to changes.
This forum is to try and sensitize, remind, encourage for us to take charge and to, men are needed. And because of the way we are reared, macho, men don't cry, men don't complain, men don't get emotional, and we keep things in, it messes us up. And as a result of that, we crash. Or, as was shared in statistics, between 30 and 50, 5 times the suicide rate, because we take the burden, we sit on it, and we suffer in silence. And when it comes to a crisis, then we seek help, and when it's a very bad diagnosis, we withdraw, we become more depressed, we try our own methodology, i.e. silence, drinking rum, whatever. And at the end of the day, it's not helping, because when you are out of the picture, that is a person who is a provider who has gone. So as a society, we say we need to address this issue. We need to put it on the forerunner, and we need to make it so relevant that we can effect a change in our men.
Dr. Cayetano, a psychiatrist, also stressed the importance of looking after men's mental and emotional well-being.
A lot of men, most times, delay seeking healthcare attention. And then we also know that men died more frequently, more often than women do. The life expectancy for women is higher than for men. So it's very important that men learn to seek help early. I think it's impressive that the organizer have managed to bring all these men who play a very important role in their society, in their families, with their families, and in the society. And we need our men to be healthy, to be strong. So the message is that strong men seek help. Strong men go and seek medical advice. Strong men are not the one that suffer in silence. Suffer in silence is detrimental to their health.
Beyond the presentations, the forum also gave attendees an opportunity to reflect on the importance of putting their health first. One participant shared that discussions served as an important reminder that regular checkups and early detection can make a significant difference, not just in preventing cancer, but in maintaining overall health.
Our forum today was very enlightening. We had the different aspect of men's health, and what I ascertained from the whole aspect was that men's health starts from the traditional way of how we perceive things is supposed to be and stuff like that, and there is a level of understanding that and a disconnect for men's health as it pertains to versus female health, because when it comes to female, they have once they take whatever, let's say for example pregnancy, and what I told them is that you go for your pregnancy checkup, and then it triggers the mechanism, and then by the time your 9 months is completed, you know whatever you have, whatever the case may be. As it pertains to men, they just tell you, and then they expect you to go, and you're supposed to show up and take a test and stuff like that. So there is a traditional gap that we need to bridge to bring. And so with this forum today, it have taught us that it start with the mental and what you think and what you think you're supposed to be, whether you're a bravado and stuff like that, and you go from there. I got an email saying that I was chosen to attend this session, a bit apprehensive about it, and came and realized that we as men, we need to talk a lot more. And sitting down in a room, we now synchronize that many of us are sitting with the same problem and stuff like that. We don't talk because tradition is that you don't talk as men, you suffer in silence and you go from there. Taking this back to the office, and I'm taking this knowledge that I got into my home household.
Organizers say the message should not end when the forum does. Among those in attendance were police officers, members of the Belize Coast Guard, healthcare workers, and participants from a variety of other sectors, highlighting that men's health is everyone's concern. They hope the conversation started today will continue in homes, workplaces, churches, and communities, encouraging men to seek medical advice early, stay informed, and take simple steps toward healthier lives. Reporting for Love News, I am Susselie Sho.